studied on kidney, same thing for the thyroid. Okay? When we measure something, you've got to make sure you see it in 2 planes. Do not measure it if it disappears. It's not real. Okay? Because sonographers, we can make pathology, we can miss pathology. Okay? When I want to look at the thyroid, I'm going to put a pillow, I'm going to lay the patient supine. I'm going to put a pillow underneath the neck, and I'm going to hyperextend so I can see. Okay? Say I have a kyphotic patient. What am I going to do? Y'all know what kyphosis is? It's where you have like a hunchback. I'm still going to hyperextend their neck, but I'm going to have to put a pillow or towels or something underneath their heads. Because if not, they won't have any way to balance their head, and they'll always be moving. Okay? One of the most common things that I look for in the thyroid or the parathyroid is called an adenoma. You can have an adenoma anywhere in the body. There's malignant ones and there's benign ones, and we're going to show you, we're going to teach you those differences. Shoulder exam, never done one. There's no preparation. I don't have any experience with musculoskeletal. That is considered musculoskeletal. Anytime they look at my shoulder, my wrist, my elbow, my knees, my hips, my spine, my hips on babies that we do, those are all considered musculoskeletal. Okay? It's easier to do them sitting up than it is to lay down. There's special chairs that they can put you in for your knee to keep you stabilized so it doesn't move around. Anytime you do the right shoulder, you do the left shoulder for comparison. Anytime you do the right wrist, you do the left wrist for comparison. Because it might be a normal, what am I thinking of? It might be normal for them, okay? Because we all have the same anatomy. It's supposed to all be in the same place. But say I've had a broken wrist on one, then I'm gonna look at the other to compare. Or a broken shoulder, okay? For a shoulder, I'm gonna do internal rotation. I'm going to do external rotation. I'm going to do abduction, okay? And I'm going to do adduction. Okay, so that way you can see that shoulder muscle move in the different planes. Usually, MSK registered technologists usually work in an orthopedic office. Okay. Now, at Bentob and at LBJ, we will be rotating through fluoroscopy, and they have an ultrasound machine in there, but they do diagnostic. I mean, they do therapeutic exams because they inject cortisone. Transabdominal pelvis, that's usually going to be with a full bladder. That full bladder is going to move the organs away from the midline so I can examine the uterus and the ovaries behind it. It also acts as a window so I can see through the bladder to those different organs. A normal uterus is positioned like this. My watch band is my cervix. And as my bladder fills up, then my uterus flattens out. Okay? As my bladder, it's anti-flexed. And then as my bladder fills up, it flattens out my uterus. so that way I'm examining the uterus at a 90-degree angle to the line of fire for the ultrasound. A Foley catheter is a catheter that is inserted into the bladder through the urethra, and it has a balloon on the end of it. That balloon is usually filled with air, and it keeps the Foley catheter inside the bladder. Okay? Older gentlemen. Now, they'll blow up that balloon about this size. Okay? Watch older men or women. I've only seen it really with men because they can pull that out and it can tear the urethra and there's lots of blood. So do your best to try to keep them from touching it. Okay? If it's an emergency situation, say a person comes in for a possible ectopic. An ectopic is a pregnancy outside of the uterus. Okay? I definitely don't want to have my patient drink liquids to fill up the bladder. Why?
Because she's pregnant already.
Huh?
Because she's pregnant already. Her uterus is
No, that's not reason.
Because
Huh?
transvaginal.
No. If they take her to surgery, I've just given her 32 ounces of water to drink. What's going to happen when they put her to sleep? She's going to aspirate and could die. Okay? So, before surgery, any type of surgery, we're NPO. Because we don't want aspiration to happen. Okay? So, if that happens, they're going to put a Foley catheter in, and then they're going to call you. We have an ectopic in room 6. What time can you be here? I'll be there, you have to be there within 30 minutes. Okay? A lot of times you have to wait for the catheter to be placed. Okay? But the clock is ticking and every minute is $1. Just think of that. Transvaginal. Transvaginal, I go in this vagina with a probe and the bladder has to be empty. Okay? So I'm going to image the uterus and sagittal and transverse. The transverse is really coronal. Okay, why? Here's my uterus. Here's my cervix. Here's my transducer. I'm shooting the bladder, the uterus, this way and this way. I'm coronal. Okay? If I'm sagittal, I still have left and right. Okay? But I'm sagittal. If I'm transverse, I'm really coronal. Don't confuse the radiologist. Put transverse on there. Okay? There is no preparation for a transvaginal ultrasound. When we look at the uterus, we want to evaluate the echo texture. It should be homogeneous. We're going to look at the uterus. We're going to look at the from the isthmus all the way up to the fundus. Oh, have y'all heard that before? Fundus. Okay, same thing. Okay, so what we're going to do is we're going to tell the radiologist, is the uterus pointing towards the backbone, which would be retroflexion, or is the uterus pointing towards the stomach, which is anteflexion? Is the uterus pointing to the patient's left, or is the uterus pointing to the patient's right? We're going to look at the endometrium. The endometrium is going to change according to the hormones that my body is putting out with my menstrual cycle. Okay? There again, anytime I measure something, it's going to be in 3 dimensions. The length is always going to be first. Okay? I'm also going to look at the adnexa. That's a new word for you. Adnexa means next to. Okay, so my ovaries are in the adnexa because they're next to the uterus. My tubes are in the adnexa. We do not see the tubes unless there's something wrong with them. Okay? You do not see the tubes unless there's something wrong with them. Patient preparation is not usually much of anything unless they have to put a Foley catheter in. We do need a full bladder for which exam, transabdominal or transvaginal? Transabdominal. The bladder has to be full. Okay? Here at Harris Health, we no longer fill their bladder unless they come to us from the emergency room. Sometimes not even then. We do transvaginals on every patient except for when they're virgin. Okay, so I have a story about that. I worked with this girl in Phoenix. I didn't really care for her. She didn't have any empathy. She just was there to collect a paycheck. She really needed to be a lawyer because she was really, she had no compassion, she had no patience, she had no empathy. And so she was doing an exam. And so she comes in there and I don't know what's wrong with this lady. She's just laying there on that bed, just praying. She has her rosary out and she's just praying. So I said, okay, I'll trade patients with you. So I went in, I traded patients with her. I said, hi, my name is Georgette, and I'm going to be your sonographer. Is there anything that I can do for you to make you comfortable? She goes, this just isn't right. It just isn't right. I said, well, what's wrong, honey? How can I help you? She goes, well, you know, I'm a nun. Nothing's ever penetrated down there. Do not assume that someone's in their 50s that they've had sex. You always ask permission. If the patient says, no, I don't want to have it done, do not do it. Okay? That's an invasion. Putting a camera up someone's vagina or putting a camera up somebody's rectum to look at their prostate. That, you know, if they don't want to do it, don't make them do it. Okay? A histosonogram. Did we finish that? Yeah, we did. Okay, a histogram. That is what we talked about yesterday, where they put a catheter into the uterus so that way they can evaluate the lining of the uterus. Okay? The only way that insurance will pay for that is dysfunctional uterine bleeding. We annotate that DUB. If they're there for infertility, they're in the wrong department. They need to be in X-ray. Okay? The front desk doesn't know that. You know that. Okay? You better catch it. Okay? Because if she's trying to get pregnant, you don't want to be messing with anything in there. Okay? It won't be the front desk that gets in trouble. It's going to be you that gets in trouble. And if it goes to court, you'll get sued. But we carry liability insurance on it. Okay. OB. You have 3 trimesters. A first trimester is from conception to 13 weeks. Okay? That is considered the first trimester. It's just like a pelvic exam, except for now you're measuring what we call a corpus luteum in one of the ovaries. It won't be in both ovaries, it'll just be in one ovary. The crown rump length, which is the baby, and the gestational sac. which holds the baby. Other than that, it's just like a pelvic exam. We always do a transvaginal exam. Always. Okay?